Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to be showing you how to apply Adaptic. So I'm actually going to be doing this with a lot of my videos because currently right now, most of my videos, they don't really show or go much in detail of how to actually apply them. I mean, the words are there, and I'm going to show you to the best of my ability. Now, I have to be super cautious actually posting pictures of wounds, okay? Just because I don't want issues with YouTube. So I do have to be very cautious with that. So you'll see it in this video how I'm going to be doing it a little bit differently. And I have been thinking about this for a very long time of how I'm going to actually show you guys without showing you a wound. So you'll see in this video how I'm going to be doing it, but it will give you a very good idea of how to apply and how to remove each of the dressings. So that is what I'm going to be working on over the next few months and what I will be posting for you guys to see. Okay, so let's get started. All right, so as you can see, I'm going to be showing you with a lot of pictures, okay? It's just the way of how I have to do things here on YouTube. So first we need to irrigate the wound. So you use your normal saline or sterile water and you cleanse the whole wound, okay? So with the saline bottle, it applies the perfect pressure to the wound, because you don't want it too soft, you don't want it too hard of water spraying on. That's why irrigation bottles are so fantastic. So you cleanse the wound, okay? You just kind of go over the wound, spraying it and getting any debris. So the bottles that come, one second, I'm gonna grab one. Okay, so I grabbed one of the bottles. Here is a normal saline irrigation bottle, okay? So you just twist the cap, okay, like that, and then you irrigate over top of the wound, okay? These are absolutely wonderful to use. Now, what do we do next? We dry the peri wound, okay? So you just want to take a sterile gauze and pat it dry around the outside of the wound, okay? So see, you have the red wound here. You would pat dry the outside area, the good tissue. Okay, that's the area that you want to pat dry. You can wipe over the wound if needed. If there's a lot of debris in there, put some saline on the gauze first and you can wipe out the wound. Make sure it's sterile and just do one wipe, okay? So when you're wiping out a wound, you're just one wipe gone with the gauze, another wipe gone with the gauze, okay? You don't want to be contaminating other areas, etc. And then, so we have the wound dry at this point, okay? And at least the peri wound is dry. The inside we want to keep moist, okay? Just moist. We don't want it pooling in there, water pooling in there, but we want a just moist environment, okay? And then we are going to cut the Adaptic, okay? So this is the Adaptic. I'll pull it out here so you can actually see it. If I can get this package open. Now you want to make sure that you are wearing gloves when you're dealing with this. So, and another thing, when you are taking off a bandage, okay, if there was a bandage on the wound and you've taken the bandage off and you're wearing gloves, make sure that you are replacing your gloves before you're putting on a new bandage, okay? You don't want to recontaminate with the old gloves, okay? So I have the mesh here, okay? And I'm going to show you what this is actually like. So it is very flexible, okay? It is a little bit sticky on the one side, okay? So it's soft on one side and a bit sticky on the other side. That's what has the actual petroleum on there. So it's the non-stick is right there. So that's the side you would put down on to the wound. So you will cut this, okay? So how I always suggest cutting it. So it's in here and you have this because you want to keep everything as sterile as possible, right? So you have your sterile scissors, you have your sterile Adaptic, and then what you're going to do is you're going to cut it in the package. Okay. Now, if need be, you can always put this, the package is see-through. You can put it over top the wound and you kind of measure it out. Don't touch the wound, but just kind of over top where you can see it through there, and you're like, oh, okay, and you're kind of like eyeballing it up. Okay, you want that 2 centimeter ring around the peri wound. Okay, so you want this Adaptic to actually cover 2 centimeters past the wound edges onto the peri wound. Okay, that's exactly how you want it. And this dressing, so I'm touching it with my hands. You obviously wouldn't do this in practical. Okay, you have scissors, you have your tweezers, use them. Okay, you're not just going to use your hands like I am. I'm trying to show you how flexible it is. It's like little holes in it, and that will allow the exudate to pass through. Okay, so this is quite great. You can use this on a various wounds, but really what it is being used for is a non-stick contact layer, just to keep a just moist wound. So you can feel on your fingers after, it's like a petroleum on your fingers. Okay, so if you had just a dab of petroleum jelly on your hands, that's what it would feel like. That's the consistency of what is on this. Okay, so once you have the Adaptic on the wound, okay, so it's on the wound, sitting there, you need to pick which cover dressing. Now, that will come from your initial assessment of how much drainage is coming from that wound. So really that's what we're doing when we're choosing a cover dressing, is how much drainage is coming from that wound. We have least absorbent to the highest absorbent. So this would be the least amount of exudate, moderate amount of exudate, and highest amount of exudate. So we choose based on that, okay? How much absorption properties do we need? And then we just pick the dressing from there. Now, to remove the dressing, okay? So you do want to grab your tweezers, okay, to remove the dressing. Now, with that said, if the dressing is sticky on there or stuck, you want to once again grab your saline and saturate it, okay? Kind of lift up the edge and try to saturate underneath the actual dressing itself. And then leave it for 2 minutes, okay? 1 to 2 minutes, leave it there, and it should start to release itself. Okay, it'll start absorbing some of that moisture and start releasing itself. So then after the 2 minutes, try to remove it again, and just keep doing that process if it's not releasing themselves, if the dressing's not releasing itself. Now, I have had it where I've had somebody go hop in the shower, get completely saturated, and by the time they're done their shower, it's just fallen off by itself. Okay, so that's what we have to do. Normally though, after that 2 minute mark of you've saturated it, let it sit, it's just going to fall right off. Now, frequency of dressing change, this can be left in place for up to 7 days. However, that depends on the amount of exudate. Okay, how much exudate is flowing through there? You have to use your clinical judgment. That's what wound care is a lot of clinical judgment of how long you're leaving on a dressing for. But it can stay on for up to 7 days, and your cover dressing is just supposed to absorb any of the exudate. Okay, so it travels through the Adaptic, so it has little holes in it. It will travel through this to the cover dressing. Okay. The expected outcome is that it doesn't adhere. Okay, so the dressing, we always want to protect the wound. Okay, any healing that we have over the past few days, we don't want to disrupt by ripping something off. Okay, so we want a material that's not going to stick, especially if we have the lower amounts of exudate. Wounds, dressings, the cover dressings tend to really stick. So we're kind of using it as a medium so that cover dressing doesn't stick. Okay, that's really what we're using this for. So that's all I have for this video, guys. I hope you did find it helpful to be able to apply Adaptic. Now, if you are looking for a more in-detailed video, I will link it here, all about Adaptic, when you should use it, why you should use it, all of that. If that's something you want to know, I will link it. And once again, that's all I have for this video. If you did find it helpful, please subscribe to my channel to have more videos show up like this one. And I will catch you in my next one, guys. Bye for now.